Good evening, everyone. Uh, Welcome to the Facebook Live program for today's evening. Myself, Dr. Phillips Routray. I'm working as a consultant diabetologist at Dr. Mohan's Diabetic Specialty Center, Bhubaneswar branch. So, today the topic we are going to discuss how to manage your diabetes in the winter season. Winter seems to be a very pleasant and cozy season. However, it doesn't bring happiness for all. What I mean by all, if you are a diabetic, you need to be extra cautious during the cold weather. It can negatively impact your health. As the temperature drops down, your blood sugar may rise up. I'll tell you what are the reasons behind the rise in blood sugar. According to the study published in the journal Scientific Reports, the low temperature can be an issue for those suffering from this chronic disease, that is diabetes. If you do not wish to let the environment have the upper hand, you must look for tips to outsmart the nature and keep yourself healthy. Now, as you know, diabetes is a metabolic disorder characterized by high blood sugar. So, sorry, due to either reduced production of insulin or body's inability to utilize the insulin produced. So, in today's world, specifically in the COVID pandemic, the management of diabetes has become a prime concern. And most of all, over the winter season, the diabetic patients are likely to suffer from higher blood sugar levels than during the warmer months as the temperature drops and the sugar levels up. So the diabetic patients should be extra careful about the temperature fluctuation, or you can say the seasonal changes. The cold weather makes diabetic experience many health problems besides creating a major change is their sugar levels. So let us first discuss what are the most harmful effects that diabetic patient may suffer from during the cold weather or the winter season. The first of all, the change in the hemoglobin level. There is a great change in their HbA1c, which we call the 3 months average sugar, 3 months average blood sugar due to HbA1c. So whatever the type of diabetes an individual is having, whether he is having type 1 diabetes or type 2 diabetes, the freezing temperature that can increase the level of A1C or the glycosylated hemoglobin. This is most likely because of the decreased physical activity. Normally in winter season समझते घरे रुहंती physical activity कम हो जाए. So the cold weather makes it very difficult for some people to go out, and you can say for the last 3-4 days in Bhubaneswar the temperature drops down drastically. So a little activity each day can help with the insulin sensitivity in whether in type 1 or type 2 diabetes, which can help the body to regulate the sugar level in a better way. So this is the first thing, the change in the A1C value, or you can say HbA1c, glycosylated hemoglobin, or in simple terms, 3 months average blood sugar. Then the second is the prone to disease. Since the immune system is also not at its best strength during the winter season, there are increased incidence of microbial infection like cold and flu, or in some cases pneumonia. As a result, the body produces some, we said, that counter regulatory hormones, which is basically good for you, that cortisol, adrenaline, glucagon, to counteract the situation. But these hormones, they affect the utilization of insulin by the body, thereby elevating the blood glucose level. Blood glucose बढ़े देती. Also, there are some condition like flu and cold which tends to make them feel lethargic and stressful, and can also prevent them from taking the proper diet which is required, which eventually can lead to an increase in the blood sugar levels. Now, next point, the most important point, we call it winter blues. You all have to understand this. It is often seen that people, they feel low during the winter seasons. uh, uh, they tend to l- go out very less and prefer to stay indoor. So less outdoor activity during the winter can sometimes trigger the mood swings, or in some cases also depression, that we call the winter blue. which in turn can shoot up the blood sugar level in their body. Thus, it is always advisable that one should spend more time with the family, with the friends, in order to keep these blues at bay. Uh, Other problems, as most diabetic patients are unaware of their nerve functions and are unable to feel the difference between the cold and hot water, which can lead to burn injury to their foot. Also, during the winter season, most diabetic patients they tend to lose feeling in their toes and feet due to the vascular changes. Therefore, it is always advisable that people should check their feet frequently, diabetic patients, so as to ensure that there is no open wound or pressure area in their feet. So one must take very good care of their feet, keep them moisturized. Inner fingers should be very clean and dry to prevent any type of fungal growth in the toes, which usually we see in the winter season. So by taking required preventive measures before the onset of winters, the diabetic patient can control their blood sugar levels, which enables them to stay away from the associated problems. Now, we'll discuss some of the uh, preventive measures, what we should do. Uh, we'll do one thing. I'll speak about 15 to 20 minutes. Then I can see there are a lot of questions in the comments. So I'll try to address most of the questions. Then I'll resume my talk. Uh, then at the end, I'll try my best to answer the remaining questions or the comments. So you can put whoever watching my video, you can put questions or your comments in the comment box so that I will try my best to take each one of you. Right. Now, since we have discussed what is the reason for that increased blood sugar, especially during the uh, winter season, so let us discuss few points: how to tackle, how to handle, how to face these problems. Number one, exercise is a very very easy to say, but I know it's very difficult to follow. But it is important. Exercise on a daily basis. It's very common to feel lazy during the winters and stop going to the gym. Who will go here? It's very cold. But that can take a toll on your health, especially if you are suffering from diabetes. The cold weather can shoot up your blood sugar level by disrupting the glucose monitoring system in your body. So you need to gather the motivation, the all kind of motivation what you want. Gather the motivation and work out to keep the blood glucose level at check. If you do not want to wish to go to a gym, then you can, no problem, you can exercise at home. But do it, whatever you can do it in the exercise in the gym or in the home, but do exercise regularly. Next most important point is avoid taking stress. Avoid the stress during the winter is very common, believe it. During the winter, in compared to the summer, the stress levels are high. A lack of sunlight can also increase the level of cortisol, which is a counter-regulatory hormone in the body, and it causes the seasonal depression. So this mood disorder can negatively affect your health. uh, you know Also, another important point, the stress is already associated with binge eating. I mean, both khai daba बस के that can increase the blood sugar level. The less exposure to sunlight can have a significant impact on your body's circadian rhythm and the ability of your body to secrete happy hormones, which includes like serotonin or melatonin. So it's better to avoid taking stress. To do so, you can involve yourself in meditation, in yoga, or start socializing a bit more. Next one, set those extra kilos. During winters, your weight loss regimen may take a backseat, and you end up having junk food under your cozy blankets. But your temptation can be disastrous for your health. So always try to control that temptation, so which can lead to the onset of obesity. As you know, diabetes and obesity nowadays, it's a single term, that is diabetes plus obesity. So obesity may disrupt your body cells ability to use the insulin hormones. So these are the few points how you can manage the diabetes or your blood sugar levels during the winter season, because at any cost it is very important to control, you know, so your blood sugar. So above all, you should make a plan. For example, planning your meals ahead and sticking by them is the important way to control diabetes. uh, this will help you to eat foods in measured amounts and will ensure that your sugar levels are balanced. For example, if you have a dinner party or function planned ahead, because nowadays you will see the lot of marriage. This is the marriage season. A lot of marriage functions are happening. So if you have a dinner party or function planned ahead, have a light breakfast and lunch to manage the calories during the dinner time, so that per day the calorie consumption will be, you know, minimalized, limited. And most important thing, what I'm going to, you know, tell you or discuss with you the regarding the flu shots, the vaccines. So a study has been conducted and it's been shown that the influenza virus is a common and self-limiting viral infection that can be treated with prescribed medication. However, when it affects the people with chronic or pre-existing condition like diabetes, the symptoms can get severe and may lead to fatal complications. So, which makes the flu shots or the influenza vaccine, flu vaccination important every year to prevent the flu and worsening your existing condition. So, it is very important. You should have your flu vaccines shot already taken. Now, next important point is the avoid skipping the meals. Right. The skipping the meals, especially the breakfast, is highly prevalent in young adults, so it's leading them to the risk of obesity and chronic conditions like diabetes. In diabetes, the skipping of any meal can cause an imbalance, in the blood glucose levels and may worsen their symptoms. And especially during the winters, in the fear of eating more and an increase in sugar levels, some diabetic patients, they try to skip meals, which is often result in their sugar spikes instead of its, reduction or its management. It just have the opposite effect. Therefore, no matter if you are a diabetic or not, please avoid skipping of the meals and instead prefer eating small portion of the food every 3 hours. That the mantra, small but frequent meals. Next, regarding the alcohol consumption, it's always better to avoid the alcohol consumption, especially in winters. They may invite more alcohol consumption. Though some studies link light to moderate alcohol consumption with good heart health and thus low risk of diabetes, but they also highlight that excess alcohol consumption, it can cause adverse effects and increase the risk of diabetes. It can also cause damage to the vital organs like the kidney, like the liver, which are involved in insulin production and management. So ultimately, having a deranged blood sugar control. Uh, Next important point is keep your insulin handy. Okay, because insulin, you all of you know, insulin should be stored at a temperature of 2 to 8 degrees Celsius and must not be, transported below 0 degree Celsius. So during the winter, the chances of damage to insulin are high due to extreme cold temperature. Therefore, the diabetics who are on insulin or medication, they need to keep their, injection, the insulin pens, the medication, in the aforementioned temperature to prevent any damage to them. Also, if you have hypoglycemia or low blood sugar, and need to keep the juice and glucose handy to make sure that keep them at an acceptable temperature to avoid freezing. So whenever you are having a hypoglycemia attack, you can use them. Now, coming to the next point, which is most important, that keeps the hand and feet warm, both the hands and feet warm, because according to a study, the people with diabetes, they have reduced ability to maintain their core body temperature because of the damage to the nerves due to very high blood sugar levels. So this dysfunction, nerve damage, they may cause the reduced sweating in summers to balance body heat and decrease blood supply in the winters to increase the body heat production. That is the, you know uh, defense system of our body. But this makes diabetic patient more prone to cold and heat induced injuries. So therefore, during winters, the diabetics are advised to keep their hands and feet warm to maintain their core body temperature and prevent further complications. uh, Last but not the least, take care of the immunity. To cope with the winter season, our body demands several, physiological and behavioral changes to maintain the overall health. So these demanding conditions can sometimes indirectly affect the immune system and can make people prone to different kind of diseases. uh, Compromisation in the immune system, especially in diabetic patient during the winter, can be challenging, and it may cause them many physical and mental health issues. So it is being suggested to adhere to a lifestyle which includes a healthy and immune boosting diet and exercise to lift up the immunity and stay healthy, especially during the winter season. So these are the few points, friends, which will help you, I believe, which will help you to combat your diabetes, or to manage. You can manage your blood sugar level more efficiently, especially during this winter season. So here I'm, stopping for a bit, and I'm looking at the questions. Mm, okay. So from Mrs. Malati Rabindran, what is the best food we can take if we are diabetic during winter season, sir? Okay, ma'am. The thing is that there is nothing different between the, as far as the best food is concerned for diabetic patients. So it is irrespective of the seasonal. That means it should have, reduced carbohydrate. It should have lots of green vegetables, lots of fruits, fresh fruits. These are included. Since you asked me during the winter season, especially during the winter is the season where we can find many fresh vegetables and also many fresh fruits. So not only during winter season, during all the time, regarding the, best food, you should avoid, you can reduce the carbohydrate intake, and you should include more of the fruits and vegetables. Overall, you should have a balanced diet so that you can manage more efficiently your blood sugar levels. Uh, Now, from King Ravi Kumar, how to avoid hypo if we are type 1? Yeah, see, hypos is hypos, or we call it hypoglycemia, or low blood sugar, is an inevitable situation which every diabetic patient, irrespective they are whether they are type 1 or type 2 patient, they must have faced uh, many times in their lifetime. Okay. And in other way, if I'm going to say, if the patient or the concerned doctor, the treating physician, they want to have a strict blood sugar control for the patient, it is inevitable that the patient will encounter with hypoglycemia. But it is always advisable to keep yourself ready uh, to fight that hypoglycemia. So in compared to the type 2 patient, definitely the type 1 diabetic patient, they have more hypoglycemia because their blood sugar fluctuate more in compared to the type 2 patient, since they do not have any endogenous insulin. They do not have any insulin production capacity inside their body. They do not have any beta cells in their body. That's the reason they are facing more fluctuation of blood sugar. But again, uh, there are many ways to avoid hypoglycemia. First of all, as we know, for type 1 diabetic patient, the only way of treatment is the insulin, because they will not respond to the tablets. So insulin, accordingly, the insulin doses should be proper. And the food, what are the type of food you are taking, that is also very important. Accordingly, which type of insulin you are being prescribed, whether it is ultra soft acting or short acting or long acting or intermediate acting, or there are new insulins are coming also, the insulin analogs. Basal insulin, they are having very low risk of hypoglycemia. If you are having, you know hypoglycemia at which point of the day, whether it is before breakfast or after lunch or before dinner, or whether at a midnight you are getting low sugar. First of all, we have to find out the reason behind your low sugar, and accordingly we have to adjust either your insulin doses or your food pattern or your physical activity. Now, from Mr. Krishnamurthy, what are the important things should I take care for my mother, sir, during this season? Mr. Krishnamurthy, I believe I have discussed many things uh, in my talk, especially how you can take care of your mother during the winter season. Uh, the next questions, sir, at all time I have cracks on my heels. What is the reason? Uh, Definitely, definitely, uh, especially during the winter season, because as you know, since the temperature dropping down, our skin becomes dry, and if you will not using good moisturizer to keep your skin moist all the time, and if your blood sugar is not under control, then definitely you are going to have cracks on your heel. So as already I mentioned, for a diabetic patient, it is always of paramount importance to take care of the feet properly. Otherwise, a small infection in the foot can lead to a future amputation also. So very small things, but you have to look at all those things. Keep your foot uh, clean all the time. You have to find out every night before going to bed, if possible with the help of a mirror. You have to find out whether you are having any cracks or any injury or any ulcer in your feet. You have to cut your nails, not very short end to end, and you have to use a good moisturizer, and you have to avoid applying the moisturizers in between your toes, that intertoe space. You have to keep those spaces very dry, because those are the most common place of infection, fungal infections. And in the winter season especially, you have to keep your foot and hands warm. Okay. Now, the next question: will diabetes affect periods, sir? Yes, the uncontrolled diabetes can affect your menstrual cycle also, uh, uh, because many times the PCOD, the polycystic ovarian disease, also has an association with diabetes. So, if anything, your menstrual cycle getting deranged, so you have to first of all find out whether your diabetes is under control or not. Then also you have to do an ultrasound abdomen to find out whether you are having the PCOD or not. uh, from Nirmal Tripathi, how to control acidity. So, Mr. Nirmal, how to control acidity? See, it's also the common problem both in diabetic patient or in normal patient, non-diabetic patients also. But again, in case of diabetic patients, they're more prone for this acidity or reflux disorder, since uncontrolled diabetes can affect also your digestive system. Number one. Number two, the diabetic patients are taking a lot of, along with the anti-diabetic medication, they're also taking a lot of other medicines like for blood pressure, for cholesterol. So first of all, we have to avoid those foods like smoking, alcohol, or tea, coffee in excess amount, which can produce the acidity. Number one. Number two, avoid being in the fasting state for a prolonged period. Have very small but frequent meals. And above all, if your acidity is not getting control with all these things, then you have to take the medication according to the doctor advice. Next, from Nas, sir, what is the difference between vials and cartridges insulin? Okay. Regarding insulin, basically the vial and cartridge, they are containing the same type of insulin, but the only difference is that in the vials you can take the insulin through the help of the syringes, But the cartridges, you have to use those cartridges in the specified insulin pens. Again, insulin pens are of two types. One is the temporary pens, which just like use and throw. You start using the pens. Once the insulin, the cartridge got finished, you have to throw it away. You have to buy a new one. Whereas the permanent pens, you have to only change the cartridges once the cartridges got over. Should From Pooja Rajiv, should we follow low carb food for type 1 during the winter? Yeah, Pooja, the thing is that not only during the winter, but for diabetic patients, whether type 1 or type 2, low carb diet is the mantra. Uh, from Swastik Swai, sir, please say in Odia. Okay, Swastik, ମୁଁ ଓଡ଼ିଆ କହିବି, ମୁଁ try କରୁଛି. Okay, how stress can affect diabetes people and how to get rid of this, sir. Okay, since this is from Nandini Pungathai, so I believe she cannot understand Odia. I'm just saying this answer in English. So, Nandini, as already I mentioned, definitely stress is the most important factor which can affect the diabetes in a negative way. And since we are discussing about the special situation like in winter season, already I have discussed about the winter blue, which is more commonly affecting people during the winter season. As during the winter season we are feeling little bit cozy since the outside temperature is very low. We have that hindrance to go out, so we spend most of the time avoiding the direct sunlight in the cozy atmosphere inside the home, most of the time behind the blankets. So it's very common that you will be affected by the stress, which may lead to binge eating and ultimately rising your blood sugar level. So it is always important to get the motivation, right kind of motivation, to get motivated so that you can hit a gym, or at best you can do the home exercises, do some yoga meditation to relieve that stress, because as you know, exercise can help you to release that happy hormone, the serotonin. Okay, and spend quality time with the family, being a little bit more, socially active, and most of the time try to avoid the stress. Okay. uh, okay. Mr. from Mr. Bhavani Shankar Pal Khadenga, why so much tablet with Rhizodec insulin? Mr. Khadenga, ମତେ ଲାଗୁଛି ଆପଣ question ଟା ଟିକେ ଅଧା ଅଛି, ମୁଁ ବୁଝିପାରିନି. Why so much of tablet with Rhizodec insulin 20? I believe ମାନେ ଆପଣ ନଉଛନ୍ତି morning 22 units, night 10 units. Okay. Uh, so we'll go to the second part. We'll go to the second part of my talk. Then after 15 minutes of my talk, again, in the last part, I will again try to address uh, most of the questions by you. So till now, I believe I have answered all your questions. So now coming to the topic. So in this part of the topic, I'll give and I'll summarize a few of the tips to manage diabetes during the winter season. Uh, the first thing is the first, maybe here I'm recapitulating or summarizing the things, the people who join later. Uh, Number one, keep your insulins and other diabetic devices in a dry, warm place. Just how hot climatic condition that can affect the diabetic medications and devices. Similarly, extreme cold temperature also have an adverse effect on your insulin by losing its effectiveness. So avoid exposing your monitor, that blood sugar monitors, and your insulin to extreme cold climates, and make sure that you cover and protect your insulin pumps, your blood glucose meters with a warmer accessory while you are out in the cold. Now, number two, protect your immune system. Already I mentioned, uh, as you know, winter spreads a lot of flu and people fall sick. So all this can lead to stress and eventually raise your blood sugar levels. So discuss with your doctor, your treating physician, if you need any annual flu vaccine or flu shot. Maintain your hygiene when it comes to using your glucometer and other diabetic medication. And don't forget to keep a hand sanitizer with you, so that you are protected from the germs as well. And especially, this is more important, you know, during the COVID pandemic. Next comes the monitor your blood glucose levels. So, during winter, there is a drastic change, climatic change conditions, like a reduction in the temperature. So, it may happen that your blood sugar can fluctuate. So, contact your doctors if you notice very frequently changing blood glucose reading with different your schedule or activity during the winter season. Next, most important, like already I mentioned, try to stay active. Keep checking your feet, because already one gentleman, he has already asked me the question in the comments. So regarding this, taking care of your feet, the cold, breezy air, they can dry out your skin and crack your feet, which may open room for infection and cuts. So make sure that you wear proper diabetic footwears for winter, and keep your feet moisturized while keeping an eye on them every single day. For example, before going to bed every night, you have to check your foot, if possible, with the help of a mirror. You have to check each and every part of your feet, especially in between the toes. And make sure you contact your doctor immediately if you notice any injury or wound which is not healing. Maybe the reason may be your blood sugar levels are not under control. That's the reason your ulcers or wounds are not getting healed up. And most important, last but the least, is check out, watch out for the COVID-19 symptoms, because still it's not over. Although many people, they have taken the double dose of the vaccine, but still it's out there. So, according to the American Diabetic Association, though there is not enough data suggesting that diabetes patients are more likely to get COVID-19 infection, but still they are at increased risk of having worse complication if at all they got that COVID-19 infection. And also, if a person has both diabetes and heart problems, heart diseases, the risk of severity of the complication are even more compared to the healthy adults. So, if you are a diabetic and have doubts about having a COVID-19 symptoms, especially during this winter season, don't get delayed. Consult a medical expert soon. Uh, Now, let us go to have the future comments to discuss regarding that. Now, from Nas again, sir, I am taking 4 time insulin with pens, but I am having too much of pain and burning sensation. What is the reason? Uh, so, Mr. Nas, you are taking 4 time insulin. The thing is that I am not aware what type of insulin you are using, or which devices, whether you are taking the insulin through the syringes or the pens. So it is ideally advisable whether you are using a syringe or you are using the pen. In both the cases, uh, two, three things you have to remember while taking the insulin. Number one is the insulin site. The best insulin site you have to take in the abdomen or in the thigh region. Every time you have to rotate the site of the injection site. If you will take it the same site every day, then definitely you are going to have pain, too much of pain or burning sensation. Number two, also, if you keep on continuing to take insulin at the same time frequently, you may have a swelling in the abdomen. So site rotation is very important. Second thing is that at regular interval you have to change the needle. If you continue to take multiple times with the same needle, that it got blunted and you will having pain. So few things you have to look while taking the insulin, so that you won't have too much of pain, because nowadays the insulin needles Uh, they are very thin, and we can say they are literally painless. Uh, from Mr. Mohan Chandra Baske, sir, how can I get rid of from tiredness? Okay, Mr. Mohan, the thing is that if you are getting tired, again, the most important point, if you are a diabetic and you are getting tiredness, most importantly, your blood sugar is not under control, because high uncontrolled blood sugar, one of the most common symptom of uncontrolled diabetes is tiredness, get easily tired or fatiguability. So first, check out your blood sugar levels. If it is not under control, try to get it under control, and try to find out your vitamin D levels or B12 levels. If it is low, get the proper medication for vitamin D, or proper the vitamins, so that you can get rid of this tiredness. From Mr. Swastik, sir, diabetes patient mane koun exercise kariba darkar? Okay, that's a very good question, Mr. Swastik. Uh, Mr. Swastik, diabetes patient mane semti kichi specific exercise nai je eiguda hi diabetes patient mane karibe au kichi karibe nai, because depend korchi jo diabetic patient ko tanko age kete. For example, ଆପଣ ଯଦି ୟଙ୍ଗ ଅଛନ୍ତି, ମୁଁ ଆପଣଙ୍କୁ ଆଡଭାଇସ୍ କରିପାରିବି ଆପଣ ଜିମ୍ ଜଏନ୍ କରନ୍ତୁ, ଆପଣ ୱାକିଂ କରନ୍ତୁ, ସାଇକ୍ଲିଂ କରନ୍ତୁ, ସୁଇମିଂ କରନ୍ତୁ। ବଟ୍ ଆଟ୍ ଦ ସେମ୍ ଟାଇମ୍ ଜଣେ 60 year old ପର୍ସନକୁ ମୁଁ, ଯାହାର ହାର୍ଟ ପ୍ରୋବ୍ଲେମ୍ ଅଛି, ଆର୍ଥରାଇଟିସ୍ ପ୍ରୋବ୍ଲେମ୍ ଅଛି, ମୁଁ ତାଙ୍କୁ ଯାଇ କହିପାରିବିନି ଯେ ଆପଣ ଜିମ୍ ଜଏନ୍ କରନ୍ତୁ, ୱେଟ୍ ଲିଫ୍ଟିଂ କରନ୍ତୁ। ବଟ୍ ଡିପେଣ୍ଡିଂ ଆପନ୍ ଏଜ୍, ସେ ପେସେଣ୍ଟଙ୍କ ଏଜ୍ କେତେ, ତାଙ୍କ ଡାଇବେଟିସ୍ ଡ୍ୟୁରେସନ୍ କେତେ, ତାଙ୍କର ଆଉ କିଛି କନକମିଟେଣ୍ଟ ଅଲଗା condition like heart problem ଅଛି କି ନାହିଁ, diabetes ଆଖି complication, eye complication ଅଛି କି ନାହିଁ, according, for example, suppose diabetes ଯୋଗୁ ଯାହାର retinopathy କିମ୍ବା ଆଖି effect ହେଲାଣି, I cannot advise them to go for a heavy weight lifting, which may worsen the eye condition. Similarly, ओवरऑल अपन जदि देखबे एक्सरसाइज को मेनली हमें देखो स्ट्रेंथनिंग एक्सरसाइज एंड मेनली कोर एक्सरसाइजेस दोरा का मतलब हमरो core exercises means the running, jogging, or simple walking, no. And then comes the strengthening exercise जोगुड़ा के अपना muscle strengthening like dumbbell उठेले कि swimming कर ले, mainly swimming, cycling, and jogging exercise. These are the core, so that अपन को भितरो अपन more strong हेबे, immunity बढ़िबो। तो डिपेंड करछि आपनक एज केते, आपनक डायबिटीज ड्यूरेशन केते, आपनक आउ किछि कंडीशन सतरे अछि कि नाही से अनुଯାयी। बट एज ए जनरल रूल कुआ जे एवरीडे 45 मिनिट वॉकिंग करिबा कथा, एटलीस्ट 5 दिन वीकली, सप्ताह रे 5 दिन वॉक करिया कथा, 2 दिन अपन गैप छाडी परियो, बट अगेन से 2 दिन कंजिक्यूटिव 2 दिन हबनी। ओके, from Pooja Rajiv, sir, is it okay sugar going up to 250 in winter? No. No, Mr. Rajiv, it is not okay, the sugar, whether it is winter or summer or spring or in the rainy season. It is never been okay the sugar to be at 250 irrespective of the season. Okay. Fasting according to your age or duration of the diabetes, fasting 90 to 110, or in elderly patient 120, and after food it should be 140 to 160, but never 250. From Malati Ravindran, is it important to store the insulin in the refrigerator? How long can we keep it outside the refrigerator? Mrs. Malati, yes, it is important to store insulin in the refrigerator, but once you start using insulin, you can keep it outside also. But you should try to avoid to expose the insulin to extreme temperatures. From Mr. Swastik again, said diabetes patient mane kon exercise kare. Okay, I have already replied that. From Kannan, what is common problem in the winter season for diabetic patients and what precautions or advice? Already I have replied that for the last 20 minutes. And from Murli Kumar, can a person with diabetes eat cakes? That too during Christmas season. Okay, Mr. Murli, this is a very tricky question. Okay, uh, as a rule, you know, you have not mentioned whether it is a sugar free cake or sugar cake. Okay, if my patients, they're having very good blood sugar control for a prolonged period of time, maybe the HbA1c is below 7%, and he's a very highly motivated patient, he is physically very active. So yes, for a reward purpose, once in a while I can allow a small bit of cake to eat. But again, as I mentioned, the patient should be very motivated. Okay, the patient is thinking like that. Okay, I have taken a piece of cake. Okay, that means tomorrow I have to set that extra calorie which I've gained last night, so I have to run extra half an hour. So it's all about the balance, how you are maintaining the blood sugar levels. um, so since any more questions, let me see. So overall, since there are no questions, I believe I have replied to all the queries. So in a nutshell, in winter season, yes, keep your blood sugar levels at under control. Most importantly, take the flu shot or the influenza vaccine on an annual basis. Especially, this is the right time to take the influenza vaccine. If you have not taken the pneumonia vaccine, you can also take the pneumonia vaccines. But you have taken anything between the last 5 years, you don't have to take the pneumonia vaccine. But influenza vaccine, you should have take the influenza vaccine annually. Uh, Keep your foot and hands warm. Go for a go for the physical activity. Hit the gym, or at home also. You can do the exercises. Have a look what you are eating. Keep your immunity, you know, at high levels by having, you are having a lot of green vegetables or fresh fruits available. Go for it. Avoid, you know, the binge eatings. Avoid alcohol and keep yourself healthy. Uh, Stem cells. Okay, from Nas about stem cells. Is there a 100% cure? Okay, Mr. Nas, regarding your just a minute. Most probably I have missed that question. What is that? I'm searching for that question, Mr. Nas. Just a minute. Uh, yeah, I got it. Is there 100% chances to cure diabetes with stem cell? Again, Mr. Nas, that's again a tricky question in the sense, although we have few advances with stem cell therapy for diabetes treatment, but still nothing is official. Everything is under investigation. We are not uh, using it on a large scale basis. It has not been commercialized yet. Yes, although they are getting some kind of a result out of it, but still it is very premature to say that we are getting 100% chances. And by saying so, in the social media, there are a lot of things talking about the reversal of diabetes. Many people, they are claiming for that reversal of diabetes. People are getting carried away, but since we are talking about the 100% chances to cure diabetes, since you have raised that question to cure diabetes, so let me tell you something very specific, very important points. The next 5 minutes, I'm going to talk about that reversal of diabetes. Okay, there are a lot of people talking in the social media that diabetes ठीक है जो diabetes cure है जो this that. So number one, it should not be reversal of diabetes. It should better you call it remission of diabetes remission, not reversal of diabetes. But if you are telling diabetes reversal, then there is another term also, re-reversal of the diabetes. The number one important point, it is not applicable to type 1 diabetic patient. Type 1 diabetic মানে যারা insulin production জমা হয়নি, it is only applicable to few of the type 2 diabetic patients. Again, not 100% type 2 diabetic patients, they can reverse their diabetes or remission, diabetes remission, only in few cases like Jaco initial stage 2 to 3 years of having diabetes, they are having with minimal medications, they are having a good amount of insulin secreting capacity, or otherwise good amount of beta cells present, or those who can lose at least 15 kilo body weight. And last but not the least, there should be they should be highly motivated. Okay, the thing is that many patients, for me also, to me also, they are coming after losing 15 kilo, and they are saying previously they are on two medicines are there, but after losing 15 kilo, their blood sugar levels are drastically coming down, they are becoming normal. Now they are not taking any medicine, diabetic medicine, for the last 3 months or 4 months, and their diabetes gone. Okay, that we call diabetes reversal. But again, let me tell you the other side of the coin. The same patient, they are coming again after 6 months, again their sugar levels are going up, then it is even higher than the previous value. That means in their lifetime they have never had such a high blood sugar levels. After 6 or 9 months, they are coming again with a, not only not 15 kilo, but again 8 to 9 kilo, 10 kilo weight gain. They came with a weight gain of 10 kilo. Then when you check their blood sugar, again it is going very high, like 200, 250. That we call re-reversal of diabetes. So, but nobody is talking about that re-reversal of diabetes. So it is a good thing if you can able to reduce your weight, whether by exercise or whether by extreme calorie restriction or low carbohydrate diet. You can able to lose 15 kilo of your body weight, and you are having very 2 to 3 early kind of diabetes you are having, and especially male people. So these are the few cases where diabetes reversal is possible. But having said so, I'm also stressing out, if you cannot control your body weight, if you cannot control your diet, then again be sure within the next 6 to 9 months, again it is going to coming back, the diabetes that we call re-reversal. So Mr. Naz, regarding your question, no, till now we do not have any success in stem cells, although we have some success, but the thing is that it is not being commercially used. um, Okay, is there any more questions? Just a minute, let me see. Okay, from Bhavani Shankar Paul Khadanga, why with Cyblex MB, Jomelismet, Udapa, Semireclimate, Telcertan 40, and Rhizodec? Okay, so Mr. Khadanga, ଆପଣଙ୍କ କ୍ୱେଶ୍ଚନ୍ ହେଉଛି ଯେ ରାଇଜୋଡେକ୍ ଗୋଟେ ଇନ୍ସୁଲିନ୍, ତା ସହିତ କାହିଁକି ଏତେ ଟ୍ୟାବଲେଟ୍ସ ଅଛି? Two type again. Mr. Khadanga, first of all, ଯେ ଜିନିଷଟା ଯେତେବେଳେ ଆପଣଙ୍କର ଅଛି, ଯେତେବେଳେ ଆପଣଙ୍କୁ ଟ୍ରିଟମେଣ୍ଟ ଦିଆହେଉଛି, ବହୁତ ଗୁଡ଼ା ଫ୍ୟାକ୍ଟର ଦେଖିବାକୁ ଅଛି। ଯେମିତି ମୁଁ କହିଲି, ଆପଣଙ୍କର ବିଟା ସେଲ୍ସ, ତ କେତେ ବିଟା ସେଲ୍ସ ଆପଣଙ୍କର ସିକ୍ରେଟ୍ ହେଉଛି ବଡିରୁ, କେତେ ନ୍ୟାଚୁରାଲ ଇନ୍ସୁଲିନ୍ ସିକ୍ରେଟ୍ ହେଉଛି ଆପଣଙ୍କ ବଡିରୁ। ଯଦି ଆପଣଙ୍କ ବଡିରୁ ଗୁଡ୍ ଆମାଉଣ୍ଟର ନ୍ୟାଚୁରାଲ ଇନ୍ସୁଲିନ୍ ସିକ୍ରେଟ୍ ହେଉଛି, ତେଣୁ ତାକୁ ୟୁଜ୍ କରିବା ପାଇଁ ଆମକୁ ଟ୍ୟାବଲେଟ୍ ଦିଆହେଇଛି। ଆଉ ଯୋଉ ବି ସବୁ ଟ୍ୟାବଲେଟ୍ ଦିଆହେଉଛି, ସବୁ ଟ୍ୟାବଲେଟ୍ର ଡିଫରେଣ୍ଟ ମେକାନିଜମ୍ ଅଫ୍ ଆକ୍ସନ୍ ଅଛି। ଯେମିତି ଆପଣଙ୍କ ସାଇବ୍ଲେକ୍ସ, ଜୋମିଲିସ୍, ୟୁଡାପା, ସମସ୍ତଙ୍କର ଅଲଗା ଅଲଗା ଡିଫରେଣ୍ଟ ମେକାନିଜମ୍ ଅଫ୍ ଆକ୍ସନ୍ ଅଛି। ଯେମିତି ସାଇବ୍ଲେକ୍ସ ଏମ୍ବି, ସେ ଟ୍ୟାବଲେଟ୍ଟା ଆପଣଙ୍କର जो एक्जिस्टिंग बीटा सेल्स अच्छी ताको स्टिमुलेट करी मोर इंसुलिन बाहर करची। यूडापा जेमते अच्छी ता काम होची आपन ब्लड रो एक्सेस शुगर को से यूरिन थ्रू रे बाहर कर दोची। सो इन स्पाइट ऑफ गिविंग ऑल द टैबलेट्स, स्टिल आपन बॉडी पे जति कि इंसुलिन रिक्वायरमेंट सेटा कवर अप हेई परनी, सेत पे आपन को आउ बाहर भी इंसुलिन दबाव पड़ुची इन द फॉर्म ऑफ राइजोडेक। सपोज एज डेज प्रोग्रेसेस आपन डायबिटीज बॉडी बॉडी चलियो, मन डायबिटीज ड्यूरेशन आफ्टर 2 years, आफ्टर 5 years, धीरे धीरे आपन ब्लड बॉडी रो द नेचुरल इंसुलिन सिक्रेटिंग कैपेसिटी धीरे धीरे कमी कमी जिवो। सेतेबेले साइब्लेक्स एमबी हो, सेमिरेक्लिमेट हो, धीरे धीरे काम करिवोनी। सेतेबेले हम कोन करिया को से टैबलेट को बंद करके आपन इंसुलिन डोज को बढ़ेबार अछि। सो बेसिकली टैबलेट्स आपन को जो दिया होछि सेटा आपन को बॉडी रो इंसुलिन सिक्रेटिंग कैपेसिटी को देखाबो, सेही अनुसार आपन बॉडी କେତେ ଡୋଜ୍ ଟ୍ୟାବଲେଟ୍ और କେତେ ଡୋଜ୍ ଇନ୍ସୁଲିନ୍ को ଯଦି ए कंडीशन ରେ ଆପଣଙ୍କର ଟ୍ୟାବଲେट्स को ବନ୍ଦ କରି ଦିଆଯାଏ ଦେନ୍ मे बी ଆପଣଙ୍କ ବର୍ତ୍ତମାନ ଯୋଉ ଏକ୍ଜିଷ୍ଟିଂ ଇନ୍ସୁଲିନ୍ ଡୋଜ୍ ଅଛି ସେଟା ବହୁତ ଅଧିକା ଦରକାର ପଡିବ। ସୋ another question from Dr. Ishwar Chandra, Metexel 50 milligram as an antihypertensive. I'm using since long. Can it be changed to another molecule of beta blocker such as nebivolol, though I'm a diabetic also? Yes, Dr. Ishwar, it can be changed, but again, we have to find out because as a rule, the ACE inhibitor or the ARBs, they are the first drug of choice in case of diabetic patients. So I have to find out whether you are on ARBs or ACE inhibitors. If not, first my preferable drug of choice should be ARB or ACE inhibitors. So thank you all for participating. Uh, uh, I'll be more interested in having the talk show on the more appropriate and recent topics. So thank you everyone for your participation. Thank you.